on Health tonight, we're diving into American Heart Month. Heart disease continues to be the leading cause of death in the United States. Recent studies, though, show women are 50% more likely to be misdiagnosed of heart attack symptoms when we compare to men. And to help us look into this whole big challenge here, this is Dr. Katie Fetten. Sie ist aus Deutschland gekommen. We were having fun speaking German. You initially from Germany. Welcome. So Doctor is here. She is a cardiac thoracic surgeon with Baylor Scott White Hospital, and that is where I want to begin tonight. So women's heart health, it's something we should all be concerned about, clearly, right? I get on my wife all the time about it, make sure we're heart healthy. What makes women's heart health unique and maybe different from a guy?
Absolutely. Women's heart disease presents a little differently, quieter symptoms.
Okay.
Not the traditional elephant sitting on the chest type presentation. Women may experience nausea, fatigue, shortness of breath, or back pain. This type of subtle symptoms may end up delaying the diagnosis.
Right. Because I would think that in the real world, and this is, listen, you can yell at guys at the same time for the same thing, but a lot of women will shrug a lot of that off and just say, it's probably something else, I'm just not feeling good today, right?
Absolutely. And so really honing in on women's symptoms and having them speak up about their symptoms is really kind of key in progressing towards better heart care. And realizing on the provider's standpoint that women didn't quite read the textbook because a lot of those studies were done on men.
Right.
So now we're discovering more and more about what women's truly present with and what we need to be focusing on.
It sounds like we're playing catch up on the female side of data for heart disease.
Absolutely.
Simple as that.
Mm-hmm.
When it comes to heart surgery itself, which is a very big deal, obviously, two-part question. Are women at higher risk? And talk about the experience for recovery. Do they experience recovery different than a man from a surgery?
Women do experience different risks. They often have smaller coronary arteries, which actually does make their surgeries more complex. The good thing about that, and the good news is that when women receive timely care, we generally are able to give them very strong outcomes. So it's really about getting them in the door, getting them assessed, and moving forward with surgical care that will provide better outcomes for women. We actually tailor our approach to women based on, of course, their medical history, but also their anatomy, and really focusing on, some of their lifestyle needs and changes so that they can return to their daily life being confident and feeling good about what's to come next.
Yeah, you deal, obviously, if you're dealing in the heart world and thoracic surgeon, you deal in some really complex stuff. What should people take away from tonight's conversation in a general sense about these scenarios specifically as they apply to women? Right,
so there are certain heart conditions such as spontaneous coronary artery dissections that, really truly find themselves into these young, healthy women. So when young, healthy women experience excruciating chest pain, they should still go and be seen. In this case, we ended up, putting a patient on a mechanical support device, then leading them to heart transplantation. And it really does remind me of how resilient women are in the whole process. And truly, how far we've come with some of the heart care that we provide.
Resilience is an easy word across the board for women. All the women in my life, resilience is a great word. Let's say someone's traveling that path to surgery. Before surgery, what can they do to prepare both physically but also emotionally? And I would think both would apply to men as well, but what's the unique case for women for those?
Right. Preparation actually does change our outcomes. So managing one's blood pressure, being as active as possible and tolerated, of course. Then in addition, managing diabetes, and then obviously staying away from tobacco products are all things that can truly change the safety of your surgery and your surgical outcomes.
Let's just look out there and say there's a number of women watching this conversation right now. And my question is going to be, what message would you want to share with anybody who watches this conversation who may be doing what we don't want them to do, and that is ignoring symptoms or feeling nervous about even the idea of heart surgery and maybe pushing back against something like that? What would your message to them be?
Of course, you are not alone. This is important, and early detection matters. All right, so moving forward and speaking with your physician when you notice something is wrong is really, really important. Truly taking charge of your own health and letting us partner with you to give you the best outcomes we can possibly hope for. Not being just scared of surgery, because this is what we do, and we will help you feel more comfortable with the process. Because overarchingly, what we want is we want every woman out there to live a healthier, longer life. And that sometimes means with heart surgery, but let's be there for our loved ones, right?
Yeah.
Let's take charge of our own health.
And we have the beauty of wonderful people like you who have been learned in the skills of putting people back together. Mm-hmm. Doctor, thank you for being here.
Thank you so much for having me.
We appreciate your time. Big time, wonderful discussion. Dr. Katie Fenton, we thank her for the discussion, and you can watch our other Eye and Health discussions right now. We've got them all posted on our CBS Texas YouTube channel.